Welcome, welcome. Hello, everybody. My name is Toni Wilder with T. Norton Consulting Services. I am a registered nurse, been a nurse for 40 years, and I just decided I'm going to start talking about the importance of healthcare workers taking care of themselves because we too need care. So, I am on a health and wellness fitness journey, and you are catching me at the very beginning of it. So you're going to see me really go through my journey. Today is Monday, November 3rd. I am broke down. I'm tired. Look at me. I mean, you're seeing me at my worst, but you will see me at my best. So anyway, right now, like I said, so I'm not at a healthy weight. I'm not comfortable in my skin. I know better. I eat pretty well, but I don't move like consistently. I'm not consistent with anything, diet or exercise, but I know better. And as healthcare workers, we know better. We teach our patients better. Um, but we don't put our oxygen mask on first, like they say, and really take care of ourselves the way we take care of our patients or our clients or whatever field you're in. So if you are a doctor, nurse, physical therapist, firefighter, paramedic, police officer, anybody in either healthcare or emergency medical services or just law enforcement, we don't take care of ourselves the way we take care of others. And a lot of us are stressed, overworked, uh, don't get enough sleep, don't have time for exercise. We have time, but it's how we use and manage our times. But the needs are so um, vast, I should say, in the areas that I just described, that they're short. They're just short of staff. So there's always a need, always a need. So being in these professions, we have a tendency to want to help others, and we have a tendency to want to serve our community, serve others. So we don't always put ourselves first, and we might take on extra shifts. We might do this, we might do that on top of managing our own lives. you know, Families, children, spouses, whatever. Caring for aging parents. Sandwich generation, a lot of us are in. I'm 58 years old. My daughters are grown, 32 and 26. So really, it's just me right now. I have a wonderful life. I'm very happy with the love and support of my family and friends that I have. But when it comes to my time management, I don't go over and beyond and do for myself like I do for my dad who's aging, or for, family and friends, or even my patients, that I see. So anyway, I just want to start this as a initial intro to what I'm going to call we too need care as healthcare providers, emergency medical service personnel, and law enforcement personnel. We need mind, body, and soul to be cared for also. And this is just a reminder to those group of people and anybody else that you may see yourself fit in this area that I may not have addressed in the type of work or field that you're in. I'm thinking about you too. So we're going to do this together. And I want you to follow along with me. And we're going to see what we're going to do. And so I'm working on my plan, setting up my fitness plan, figuring out what nutritional plan I'm going to be on. I've tried it all. Keto, carnivore, Weight Watchers. I mean, you name it, I've pretty much done it. All except for like the GLP-1s, the Ozempics and all that stuff. I've not done any of those. To each his own who need to do that and want to do that. I don't like shots. So I'm not doing it and giving myself a shot unless I have to. Unless I absolutely have to. Otherwise, what I do need to know and what we all know, and remember and understand this, and I'm talking to you like I'm talking to me. We are the only ones that control what we put here in our mouths, okay? We are the only ones who decide if and when we move our bodies like we know we should, like we teach our patients, like we may tell people we see, our clients, whatever, whomever. Um, you know, there are healthcare workers, you've seen them, because I've seen them, overweight, firefighters, overweight, doctors, overweight, nurses, police officers. I mean, these people, we're not healthy. We're not our best, we're not in our most optimal conditions, health conditions and statuses. And we too need care. So I'm going to start with myself, self-care. And I'm welcoming you in a journey. So deal with me. Like I said, this is new to me. This is my first time doing this. First video. Hopefully it'll get better with, filming, with what I'm doing, and all of that. So I'm excited. I'm happy to bring you along. People that know me really know that I am really a cuckoo bird. Like I just like to have fun. I don't take life or myself too seriously. So anyway, welcome again to this series of We Too, episode 1. We Too Need Care. I'll see you soon. Bye.